Today we are discussing about tumor. Tumor is a pathologic disturbance of cell growth characterized by excessive and abnormal proliferation of cells and their abnormal mass of tissue, which may be solid or fluid filled. When the cells are abnormal and grow uncontrollably, they are concluded as cancerous cells, that is malignant, and another type of cells which are abnormal and non-cancerous, they are known as benign tumor, and the tumors are also called neoplasm. To determine whether a tumor is benign or malignant, a doctor can take a sample of the cells with a biopsy procedure. The tumor begins when the DNA of the healthy cells is damaged, causing the cells to change and grow out of control, forming a mass. A tumor can be cancerous or non-cancerous. A cancerous tumor is malignant. It can grow and spread to other parts of the body if not found early and treated. And the first one is benign tumor, and they are non-cancerous and they are concluded as benign tumor. It won't invade nearby tissues or spread to other areas of the body, and this is known as metastasis. A benign tumor is less harmful unless it is present nearby any important organs, tissues, nerves, or blood vessels, causing damage. Fibroids in the uterus and breast, polyps of colon, and the moles are some examples of benign tumors. Benign tumors may grow very large, sometimes weighing pounds. They can be dangerous, such as when they occur in the brain and crowd the normal structures in the enclosed space of the skull. They can press on vital organs or block channels. Some type of benign tumors, such as intestinal polyps, are considered as precancerous and are removed immediately to prevent them becoming malignant. Benign tumors usually don't reoccur once removed. If they do so, it is usually in the same place. Benign tumors can be removed by surgery. And the other type of tumor is malignant tumor, and they are cancerous and can invade nearby tissues. Some cancer cells can move into the bloodstream or lymph nodes where they can spread to other tissues within the body, and it is known as metastasis. And the cancer can occur anywhere in the body, including the breast, lungs, intestines, reproductive organs, blood, or skin. Example: breast cancer begins in the breast tissue and may spread to lymph nodes in the armpit. If it's not caught early and treated, that cancer cells can travel to other areas of the body like the bones or liver. The breast cancer cells can then form tumors in those locations referred as secondary tumor. A biopsy of these tumors might show characteristics of the original breast cancer tumor. Example: breast cancer, skin cancer, etc. And this is a picture of benign tumor, and the second one is malignant tumor and their features. And the another tumor is pre-malignant, and these tumors, the cells are not yet cancerous but they have the potential to become malignant, and they have some similarity and dissimilarities. First one is similarity: all the tumors, that is malignant and benign, have the same components. First one is clonal neoplastic cells that constitute their parenchyma, and the second one is reactive stroma made up of connective tissue, blood cells, and variable number of macrophages and lymphocytes. And the differences between the tumors are growth rate. Malignant tumor grow rapidly than benign tumor on the basis of invade locally, distance to spread, reoccurrence, cellular appearances, systematic effect, and the treatment. Can be also be noted that benign tumor completely cured with surgery or may be treated with radiation therapy, chemotherapy, and the malignant tumor treated by chemotherapy, radiation therapy, or immunotherapy medication. And there are some type of tumors mentioned here, and the first one is brain tumor. Brain tumor is a mass or growth of abnormal cells in the brain. Many different type of brain tumors exist. Some brain tumors are known cancerous or some are cancerous. Brain tumors can begin in the brain or can begin in other parts of the body and spread to brain is such as secondary brain tumors. And there are some symptoms of brain tumors. They are headaches, nausea or vomiting, vision problem, blood vision, loss of sensation gradually or the movement in an arm or leg, difficulty in breathing, speech difficulties, feeling very tired, confusion in every factor, etc. Many different type of primary brain tumors exist and its name is from its type of cells where it forms. Example, gliomas, pituitary adenomas, meningiomas, germ cell tumors, etc. And the secondary tumor or metastatic brain tumors that result from the cancer that starts elsewhere in the body and spreads to the brain. Secondary brain tumors occur in people who have a history of cancer. Rarely, metastatic brain tumor may be the first sign of cancer that began elsewhere in your body. In adults, secondary brain tumors are far more common than the primary brain tumors. Any tumors that spread to brain that includes breast cancer, colon cancer, kidney cancer, lung cancer, etc. And the factors, there are some factors that can increase the risk of brain tumor that are exposure of radiation, genetic syndromes that passing among family. And the other type of tumor mentioned here is known as pituitary tumor, and they are known cancerous tumors in the pituitary gland that won't spread beyond the skull. The pituitary gland is in the skull below the brain and above the nasal passages. A large tumor can press upon and damage the brain and nerves. Very rare tumor. Still, the tumor can cause serious problem, either because of their size or because they can make extra hormones on body doesn't need. They are typically treated with surgery, medicine, or radiation. There are reliable research studies showing severe stress, childhood trauma, and or physical trauma increase the likelihood of the development of a pituitary tumor. And there are some symptoms for the pituitary tumor that are vision problems, headaches, mood changes, interfere with menstrual cycle and cause sexual dysfunction, irritability, infertility, etc. And they can be treated with surgery and medication to block excess hormone production or shrink the tumor. In some cases, radiation can also be used. Thank you.